Welcome to this explainer on the profound benefits of pelvic floor physiotherapy. If you've been navigating the often frustrating and frankly pretty isolating journey of chronic or acute pelvic pain, you are exactly where you need to be. We're going to dive right in today because we've got some absolutely vital information to unpack that could genuinely, seriously change your quality of life. Let's get to it. So, have you ever been told that your pain is just part of being a woman? Or even worse, that it's all in your head? If you've been dealing with things like painful intercourse, severe tailbone pain, or ongoing bladder dysfunction, and you've just felt completely brushed off by the medical system, I need you to hear this loud and clear right now. Your pain is incredibly real. It is absolutely not in your head, and the best part, there are actual evidence-based treatments that can help you. Section 1. Your pain is real. Section 2. Understanding your pelvic floor. Okay, so the pelvic floor isn't just one single muscle. Instead, think of it as this complex, dynamic hammock of muscles. It's an incredible structure, really, and it plays a continuous, absolutely crucial role in your urinary control, your bowel function, sexual health, and even your overall core stability. But here's the kicker. When this hammock gets too tight or too weak, that's exactly when the issues start cascading. Now, there's a pretty common misconception out there that we only really need to talk about these muscles during pregnancy or the postpartum period, but that's just not true. Maintaining a healthy pelvic floor is critical during literally all major life changes. We're talking about navigating weight gain, the big hormonal shifts of menopause, and even post-surgery recovery, like after hysterectomy or abdominal surgery. Your pelvic floor needs real support through all of these stages. Section 3. Recognizing the warning sign. So what should you be looking out for? Well, the most common red flags are things like leaking a little urine when you cough, sneeze, or exercise. Or, maybe you're dealing with unexplained pain in your pelvic region, your lower back, or your hips. It could even be bowel issues like persistent constipation or pain during and after intimacy. Some people even get this constant urge to urinate or a really concerning feeling of heaviness or pressure down there. And that heaviness could actually be a sign of pelvic organ prolapse, which is where the organs physically shift out of place. Now, stay with me here because this next part is huge. While these symptoms are incredibly common, they are absolutely not something you just have to live with. No way. They are not something you have to just accept as normal aging. You deserve this care, and you deserve to feel completely comfortable and confident in your own body. Section 4. How physiotherapy can help. All right, so what does treatment actually look like? It's basically a guided, step-by-step process. First up, you get a really detailed, unhurried assessment of your posture, your breathing, and how your muscles are coordinating, just to pinpoint any imbalances. From there, the physiotherapist uses gentle manual therapy and trigger point release. And hey, it's super important to note here that these sessions are entirely guided by your comfort. The whole goal is to help your body relax and function properly again, without adding to your pain. Finally, you'll get personalized exercises and might even use some cool tools like biofeedback. That's where they use sensors so you can literally see how your muscles are contracting on a screen. It's a game changer for restoring your strength and balance, and you are always in complete control of the process. We so often default to reactive treatment, right? Like waiting until we're in severe pain or facing massive complications after a surgery before we finally ask for help. But proactive care is a whole different ballgame. It's about annual checkups and early detection. You really don't have to wait for the symptoms to show up. A simple annual pelvic health assessment can catch tension or weakness super early, making it an incredibly powerful preventative measure. As the specialists always point out, prevention is just straight up easier and way more effective than treatment. Getting regular assessments gives you highly personalized advice to keep up your strength, your confidence, and your function long before any complex, painful problems even get a chance to start. Think of it exactly like going in for your annual checkup with the dentist or your family doctor. Section 5. Your journey with OVA. Which brings us to OVA Women's Health. They're a dedicated clinic located out in Burnaby, British Columbia. But listen, they aren't just your standard run-of-the-mill general physiotherapists. The team at OVA are international experts. They are specifically trained in advanced women's pelvic health and really complex pelvic pain conditions. They truly understand what you're going through. Over 2,000. Let that sink in. That's how many complex pelvic pain and dysfunction cases they have successfully treated. They bring this advanced global training to every single appointment, giving you highly personalized, evidence-based care. And they do it in a safe, compassionate space where your pain is taken seriously from the very first minute you walk through the door. And Honestly, this might be the best part for anyone who's just exhausted by all the medical red tape. You don't even need a doctor's referral to start. You can just book directly and be seen quickly. And really, the sooner you start, the sooner you can get your comfort back, regain control over your bowel and bladder, and rebuild that connection in your intimate life. Look, you have been patient for way too long. If you are ready to take that very first step toward lasting pelvic health, simply scan the QR code to connect directly with OVA Women's Health today and book your consultation. Prioritizing this care, it's an absolutely essential part of your overall well-being.
I want to leave you with this one final thought today. You do not have to live with pelvic pain. You deserve to feel strong, balanced, and totally supported in your body at every single stage of your life. So, what proactive step are you going to take today to reclaim your well-being and finally get the care you deserve? Thank you so much for joining me for this explainer, and please take good care of yourself.